Hey Milton, I appreciate you meeting with me and doing this peer-to-peer evaluation with me.
Oh, no problem, Gabe. I just want to go over this form with you. I filled it out and I just want to go over it with you. Question number one was, how often does your peer participate in shared governance on your unit or house-wide in order to contribute to positive patient outcomes? I gave you number 4, which is almost always. I've been to these meetings, I've seen you raise your hand, I've seen you ask really good questions and have really good answers. The only thing is, I think you're at that point to where you really should be president of one of these committees, so I think you could work towards a 5 for next year.
That'll work. That's something I'm thinking about getting involved with in the future. So.
Yes, sir. The second question was, how consistently does your peer demonstrate compassionate care when dealing with patients and families? I had to give you a 5, Gabe, because really I've been watching you and I've seen you do patient care, and you treat everyone like they're your grandpa and your grandma. I mean, you're so nice to them and so helpful for them. So I gave you a number 5, and I wish that you would continue doing that.
Thank you.
The third question was, how often does your peer use evidence-based practice and other resources to ensure their everyday care is in best in class? I had to give you a number 5. And the reason is because I've seen you, when you have questions, you use like all our resources on our computers, you've used UpToDate. I've seen you use Micromedics. I've seen you ask the doctors, just to make sure that this is the best thing for the patient. So if you could just show other folks that you work with on your unit, that these resources are also available, that would be great. But I gave you number 5 there.
Yes.
Here we say, how consistently does your peer show financial stewardship by completing tasks on time and managing resources? I gave you almost always a number 4, and the reason is because I've seen you, like when you start IVs, I've seen you take a lot of supplies in the room. If it's possible, if you could just use a few less supplies. I know it's hard running back and forth and you want to look prepared, but if you could take some supplies and maybe leave them outside the patient's room, that way if you don't use it, you could always return it back and not have an extra cost to the patient.
Okay, that's a good idea.
Here, how consistently does your peer participate in community-based programs? I had to give you a 3 here for sometimes, and the reason is, I think there's some places that you could volunteer for. If you have time, one of them is definitely Habitat for Humanity, Bethesda House. So if you could work on that there, I gave you a 3 here, which is sometimes.
Well, maybe I'll see if I can get some resources, locate some of those and try to get more involved.
Yes, sir. And you're so helpful already. I think you would really enjoy these 2. Here, how consistently does your peer effectively collaborate with other disciplines to provide care? I give you a 5, and the reason is I've seen you doing rapid responses, or even before rapid responses, I've seen you call the charge nurses, call other units, other departments. I've seen you call the doctors, pharmacy, respiratory therapists. Every time there's someone in trouble, I've seen you follow up and continue doing that, because that's always a good thing for the patients.
Thank you.
The last one is, how consistently does your peer effectively advocate for patients and families? I gave you a 4 here, almost always. Now I don't want you to think that's a bad thing. And the only reason I gave you number 4 is I want you to continue to provide excellent patient care and keep, we always have room for improvement.
Right.
And I always want you to keep doing that.
Yeah.
Thank you.
All right, appreciate it. Thank you for your time.
You're welcome, sir. You're welcome.
Thank you.
Thank you.